Doctors don't go to medical school to learn billing codes. They study to heal, to diagnose, to comfort, not to memorize thousands of pages of insurance rules. Yet in modern healthcare, every note a doctor writes determines whether their practice gets paid or denied. Behind every patient encounter lies a hidden administrative maze, where one missing modifier or vague diagnosis can cost thousands. It's a frustrating truth. Good medicine doesn't always translate into good paperwork, and that's where CodeCraftMD comes in, to bridge the gap between clinical care and compliant billing. Every day, healthcare providers face this silent struggle. After seeing a patient, the physician documents the visit, describing symptoms, diagnoses, and treatments. But to insurance companies, none of that matters unless it's translated into the exact codes they recognize: precise ICD-10, CPT, and modifier combinations. Miss one small detail and your claim may bounce back with a red stamp of denial. The result? Lost time, lost revenue, and mounting frustration. Across the United States, these simple administrative errors account for more than $40 billion lost every year. It's a problem that doesn't just drain money, it drains morale. Physicians are forced to spend hours correcting paperwork instead of caring for patients. That's not what medicine was meant to be. CodeCraftMD was created to change that. It's an AI-powered medical billing intelligence platform designed specifically for clinicians, not coders. The mission was clear from the start: to make documentation smarter, faster, and fully compliant. CodeCraftMD reads your clinical notes like a human, reasons like an expert coder, and automatically generates a clean, compliant CMS 1500 billing form ready for submission. It transforms free text documentation into precise billing codes in seconds, with the accuracy of an experienced medical biller and the consistency of artificial intelligence. The idea was born out of frustration many doctors share: hours wasted trying to make sense of billing requirements, double-checking codes, and navigating the endless updates to CMS rules. The founders of CodeCraftMD realized that this administrative burden wasn't just slowing down clinics, it was fundamentally disrupting the relationship between doctors and their patients. So they decided to build a tool that could think like both: empathetic to the human story within the medical note, yet logical enough to meet the rigid expectations of insurers. Here's how it works. A clinician uploads a note, whether it's a Word document, a PDF, or even a simple text file. The platform immediately begins processing, powered by advanced GPT-4o intelligence fine-tuned for healthcare. It analyzes the text, identifies potential diagnoses and procedures, and matches them to the most specific ICD-10 codes. Each code is ranked by confidence level, specificity, and relevance, so the user always understands why a code was chosen. And because the CMS 1500 form only allows a maximum of 12 diagnosis codes, CodeCraftMD automatically filters for the top, most accurate results. What used to take hours of manual cross-referencing now takes seconds, and with fewer errors than ever before. Accuracy, however, is only part of the story. In healthcare, compliance is everything. That's why CodeCraftMD was built with a HIPAA-first design philosophy. From the moment a file is uploaded, all protected health information is encrypted and anonymized. Patient names and identifiers are masked. Data is transmitted through secure TLS 1.3 channels and stored using AES 256 encryption, the same standard used by major healthcare systems worldwide. Every interaction on the platform, whether it's an AI suggestion or a manual edit by a human, is logged in a 7-year immutable audit trail. This means that every code, every change, and every decision can be traced back and verified at any time. Transparency isn't an afterthought, it's built into the foundation. CodeCraftMD also ensures users stay audit-ready at all times. If an insurance company or compliance officer ever questions a claim, users can instantly generate a full audit report that shows exactly how each code was derived, when it was added, and who confirmed it. This level of accountability gives clinicians peace of mind, knowing that their documentation stands up not just to scrutiny, but to evolving industry standards. In a field where privacy breaches and audit risks can destroy reputations, CodeCraftMD provides a layer of protection that's both invisible and invaluable. But technology is only meaningful if it makes a real difference. That's why the results speak louder than the code itself. Clinics using CodeCraftMD have reported up to a 90% reduction in billing errors. Claims that once took days to process are now submitted within minutes. Denials have dropped dramatically, and reimbursements are arriving faster than ever before. More importantly, doctors are spending less time behind screens and more time in front of patients. The ripple effect is profound. Better cash flow for practices, less burnout for staff, and a renewed focus on patient care, the very reason most entered medicine in the first place. Discover how CodeCraftMD can transform your billing workflow. Experience how it turns your clinical notes into clarity, compliance, and cash flow, all in one place. Because when documentation becomes intelligent, medicine becomes more human. Visit CodeCraftMD.com and see how we're innovating medicine through compassion and code.